topic I'm presenting today is therapeutic communication in the psychiatric nursing setting and the nurse-client relationship. Whether in a hospital or psychiatric care setting, having the knowledge of and the ability to apply therapeutic communication techniques can play a crucial role in ensuring the patients are receiving the best care possible. Utilizing these techniques helps us as nurses to build trusting relationships with our patient within a short period of time. In fact, according to Mary Townsend in the book Psychiatric Mental Health Nursing, Concepts of Care in Evidence-Based Practice, the 6th edition, these techniques aid us in obtaining the most accurate account of the patient's history and in planning interventions while caring for our patients. NursingPlanet.com defines therapeutic communication as use of oneself in therapeutic communication as the ability to use one's personality consciously and in full awareness in an attempt to establish relatedness and to structure nursing interventions. The website also states that therapeutic use of self is the instrument for delivery of care to clients in need of psychosocial intervention. The reason why therapeutic communication is so important in the field of psychiatric nursing is explained best in the book Mastering the World of Psychology, the 2nd edition, written by Wood, and Boyd. Insight therapies are used in this book to aid the patient in understanding their own thoughts, feelings, purposes, actions, and coping mechanisms through utilizing therapeutic communication techniques. Many of these examples on communication techniques are utilized throughout the presentation. These examples come from one or more of the following sources: Mary Townsend's Psychiatric Mental Health Nursing, Concepts of Care and Evidence-Based Practice, the 6th edition, John Zing's The Use of Effective Therapeutic Communication Skills in the Nursing Practice, Cheryl Hamilton and Bonnie Creel's Communicating for Success, Lynn Jones's article, The Healing Relationship, and Herschel Knapp's Therapeutic Communication, Developing Professional Skills. The first step in understanding what therapeutic or positive communication is understanding what it is not. Here's an example of non-therapeutic or negative communication. I'd like to welcome Hannah Adams who's helping me out with this presentation today.
I just feel so worthless and helpless. My life is a real mess, and I don't know if I can see my way out of it. What should I do?
I'm certain things will get better just as soon as you realize that you just can't fix everything. Giving reassurance devalues the patient's feelings. When you say, "I'm certain that things will get better," you're giving false reassurance to that client. You don't know that things are going to get better. They could get worse. Giving advice also discourages independent thinking and implies that a patient is incapable of making their own decisions. When the client is asking you for advice, it's always good to use reflection to help the patient draw conclusions. You don't want to just give them advice because it's discouraging independent thinking.
If I can't fix my life, maybe it isn't worth living.
You really shouldn't talk like that. Let's talk about something else. Has your mother came to visit you yet today? Rejecting. Whenever you tell a patient that they shouldn't say things, you're rejecting what that patient says. This may cause the patient to discontinue any further interaction with the nurse for fear of further rejection. And introducing unrelated topics such as, "Has your mother came to visit you yet today?" whenever the patient is obviously upset, you're basically causing the patient to just completely shut down. They're not going to open up to you because they feel as though what they're saying can easily be looked over or ignored, that what they have to say and who they are is not important, and that's not something that you want to get across. Now that you know what some of the non-therapeutic communication techniques are, here's an example of some therapeutic communication techniques that can be used instead. "Hi, Hannah. How are you doing today? You look pretty down in the dumps." Giving broad openings emphasizes the importance of the patient's role in interaction by allowing them to take the initiative in introducing the topic. Then that's how the broad opening is, "How are you doing today?" so it leaves it open for the patient to tell you how they are doing or to discuss something else if they prefer. Making observations, basically just verbalizing or whatever you're observing or perceive, encourages the patient to recognize specific behaviors and compare perceptions with the nurse. So, you look pretty down in the dumps. The patient could be like, well, yeah, I guess I am pretty down in the dumps. Let me explain to you why. And that just helps you develop that relationship with them and continue the conversation.
I feel so worthless and helpless. I just don't know if I can see my way out of this. What should I do?
If you'd like to talk about it, I will sit here with you for a while. When the nurse offers to sit and discuss situations with the client, it really opens up the door of communication, so to speak. The nurse, what she's doing is offering herself. She's making herself available on an unconditional basis. It increases the patient's feelings of self-worth, as well as further building upon a trusting nurse-client relationship.
I just feel like I can't do anything right.
Yes, I see. Go on.
Well, my father always told me I was good for nothing, and I just couldn't ever do anything right. I feel like I'm finally starting to get my life together, but I don't know what I'm supposed to do next. I wish I could just fix everything, you know? Do you think I should, tell him how bad that he's been, made me feel? I mean, I should confront him, right?
What do you think you should do? So, just to backtrack a little bit, whenever the nurse says, yes, I see, go on, she's offering a general lead. She offers the patient encouragement to continue with the conversation, to continue giving information. You're saying, I'm open to what you're saying. If you feel like you need to discuss this, we can discuss it further. Now, whenever the nurse says, what do you think you should do? That's where she's using reflection. She's asking the patient to go back and consider what she said. And it also helps in avoiding giving advice, which would be like a non-therapeutic technique. And this causes the patient to kind of question, to kind of reflect on questions and feelings that are being referred back to them so that they can be recognized and dealt with. And it also helps the patient recognize that his or her point of view has value.
Well, I guess I'm not really sure what I should do yet. I just feel like there's this big cloud hanging over my head because of him.
This point seems worth looking at more closely. Perhaps you and I can discuss it together this afternoon, around 3?
I'd like that.
Whenever the nurse offers to discuss the point more closely, she's focusing on what that patient's going through. And she's letting the patient know that they've been heard, that what they have said matters, that you're interested and that their thoughts and feelings are important. So you're sort of just validating the patient. Caitlin Kafaza, registered nurse that works in the pediatric intensive care unit at St. John's Mercy, said, after therapeutically communicating with my patients, I feel they benefit by learning that they are understood, not judged, that they are not alone, and that there are better ways to cope and deal with their frustrations. They learn that their lives are important and that there are resources to help them in the future. Ms. Kafaza is employed in both the area that she's in. She covers both physical and mental illnesses, so she feels like she gets a wide spectrum and she's able to really help those psychiatric patients in that way. And the key thing to keep in mind when communicating with a psychiatric patient is that therapeutic communication is the cornerstone in developing and maintaining a healthy nurse-client relationship. It aids in obtaining an accurate account of the patient's status and is a crucial element utilized in the planning and implementation of care, with the goal of promoting positive patient outcomes, and isn't that what we as nurses want for our patients? Thanks for watching.